someone asked, can anyone from Hertfordshire access the support group, or does it have to be from a local area? We do take referrals for out of area for the pulmonary fibrosis support group. What we have to make sure, though, is that when patients have to be able to travel to the hospice, obviously, to be able to participate. And if they can participate and their oxygen requirement is not too high to enable them to do that, then they can come to the group. But we also have to liaise with the local community palliative care services, so that when they're no longer able to come, then somebody else can take over and step into the gap, because obviously we can't go out and see people at home when they live 30 miles away. So I hope that's helpful.
Thanks, Sharon. Right, Claire, shall we move on? I'm just mindful that I want Claire to have some time to talk about the carers service. If we just go a couple of slides forwards.
I'm going to stop the recording because it's
playing up, isn't it?
Yeah.
Recording stopped.
That's better. So these are just a couple of slides about the benefits of palliative rehab. This document from the Hospice UK in 2015, I don't know if this is a new term or if it's a term that Hospice UK made up, but I really like the word habilitation, which is a useful phrase to recognise that when we talk about palliative rehab, we're not necessarily thinking these people that we're looking after are going to go back to a baseline of function, but it's about, because they're palliative, they're likely to progress with their condition and potentially have the physical side effects that go along with that. But it's all about recognising what's important to them and keeping their independence for as long as possible, and living their life and adjusting their goals accordingly to make their life meaningful. And I think that's what, for me, habilitation means. These are some of the common tools we use for anxiety and breathlessness. Hopefully, nothing here is going to be that new to you to see, whether you've seen these specific breathlessness management tools, so they're non-pharmacological management, or whether they're similar to what you've seen. But really the key things we always talk about is handheld fan therapy is probably the number one thing that we will make sure that they're aware of. Using a handheld fan there is some evidence out there, but it really helps to alleviate that immediate feeling of breathlessness. For example, if they've just climbed up a flight of stairs, or they've just done some walking or got into the car or waiting in a waiting room, if they have a handheld fan, it's that feeling of fresh air blowing on their face and their nose and their mouth, and it's shown that it stimulates your trigeminal nerves, which then helps to dampen down your respiratory drive. There are other things like the calming hand positioning and rectangular breathing. Just a quick plug, I can't talk about all of these in lots of detail, but we are going to do a whole lunchtime session on hands-on approach for the management of common palliative symptoms with my complementary therapist, Sandy, and it's all about the non-pharmacological management. So please, if you're interested and want more detail on this, have a look at our website too, and we'll spend 2 hours on that, in fact.
It's always nice to share some.
I don't know why I'm still talking. I'm being haunted. I think we should swiftly move on to Claire to talk about the carer service.
Okay, thank you very much. The next. Yes, I think first of all it's really important. We've talked a lot of us have used this evening the term carer, and I think we just have to be very cautious how we use that term, because a lot of people that we're supporting and the families we're working with don't necessarily see themselves as a carer. So if we're using language and terminology that people don't relate to, that can immediately turn those people away or feel that they're not in need of the support because they're not a carer. So I think it's worth we're talking here about an informal carer. And that's defined as anyone who cares unpaid for a family member or friend due to illness, disability, mental health problem, or an addiction, and who cannot cope without their support. So a lot of people, as I've already said, will see themselves as a husband or a daughter. So part of our role is ensuring that people recognise the support they're giving. And I think one of the questions in the question box was, how can a carer be helpful to their patients with pulmonary fibrosis? Hopefully I am going to answer some of that, but I think the most important thing is, if that person's preferred place of death is at home, how can the person possibly die at home if the carer hasn't got any understanding of what that might involve, what they may need to do, what they may need to plan to make that very difficult, potentially stressful situation as easy as it might be, and to recognise when they may need to get help, but also to be daring, as we've already said, about having conversations about what that patient may want. And so a lot of my role may involve encouraging those difficult conversations, planning quite clearly what that person wants, and going into, I sometimes find that if someone's been quite not wanting to talk about advanced care planning, actually if we talk to the carer of wife, husband, daughter separately, it does make quite a difference to their understanding, and therefore they're able to have those conversations with the nurse or the doctor in a far better way, and with a better understanding. Next slide, please. So I think we've talked quite a lot about the group separating into two, and I'm very lucky to also be able to offer, if it's relevant and if the people want it, to have an individual assessment one-to-one, which is also obviously helpful when you're running supporting a group. It's good to understand each person's situation in more detail, recognising again we're all very, very different. Our experiences of loss, stress, death will have a huge impact on how we manage, and I think we're all different, and so we will all cope or not cope so well with certain things. Here we use, some of you may have heard about the CESNAT, so the Carer Support Needs Assessment Tool Intervention, which I haven't really got time to talk in detail now, but it's a well-recognised and validated tool. And we've already talked about the importance of the group support, and again it comes down to people sharing and recognising and understanding that they're not the only ones that sometimes have not such good days and they get cross or they get irritable. But we also do have speakers come in, or we might have a theme of maybe some well-being, so creative therapy or yoga, meditation, as well as other topics, maybe advanced care planning, dietitian and things like that. Next slide, please.